Thank you everyone for joining us to learn about this fantastic opportunity to form a team in your state and participate in the National Quality Initiative, Collaborative Improvement, and Innovation Network. In this webinar, you'll learn more about what participating in this coin will make possible for you in your state and how to apply. Before we begin, we do have a few announcements. All attendees are in listen-only mode. However, we would love to hear your questions, so please use the chat box that is located in your Zoom control panel. This webinar is being recorded and will be available on our website in 1 to 2 business days. Also, we will ask for you to complete evaluation questions at the end of this presentation. Your feedback is very vital to us. Thank you, and I will now turn it over to John Slitt.
Thank you, Tiara, and good day to everybody. I think the first thing I want to ask is, are we all headed in the same direction? Ever been on a plane and someone says, if you aren't going to Dallas, now is the time to get off the plane? And so I want to offer that the National Quality Improvement Initiative for School Health Services is actually divided into 2 model types or categories. One, school-based health centers, and the other, comprehensive school mental health systems. And so I just want to be clear to all of our audience today that we are going to be talking specifically about the coin for school-based health centers. So if you've logged on today hoping to hear about comprehensive school mental health systems, this is not your webinar. That webinar is scheduled tomorrow. And I have put the webinar address, registration and information address on our screen so that you may copy it now and quietly walk away from this webinar. We would encourage you to stay, however, if you're curious, but we just wanted to let you know up front that there are 2 different coins being operated under this initiative. We'll say a little more about that, but we wanted to give everybody a heads up to make sure that you're on the right webinar. Okay? Fair enough. So, good day and welcome to the informational webinar of the School Health Services National Quality Improvement Initiative. I am John Schlitt. I am the president of the School-Based Health Alliance, and I am joined today by my colleagues, Paula Fields, Tiara Brooks, and Haley Love, who are among a group of us who are both steering and rowing this ship we call the NQI. We also have some participants from our first coin from Connecticut who are going to share a little bit about their experience and the first generation of our national quality improvement work. The NQI has several parts, and key among them is the learning community that we're about to introduce to you today. Its official term is a Collaborative Innovation and Improvement Network, also called the COIN. I commend you for your wisdom and courage that you've demonstrated just by showing up today. Perhaps you're simply COIN curious, or maybe you're already a self-possessed quality improvement maven. But whatever brings you to this moment, you are a leader, and we thank you for that. Our chief goal over the next 30 to 40 minutes is to inspire you to join together with other leaders like yourself in an immersive effort to document the value of school-based health centers to children and adolescents, to your education partners, and to the larger healthcare system. And I cannot begin without invoking this well-known sentiment that's attributed to the father of quality assurance, Edwards Deming. And for those of you who don't have the screen in front of you, it says, "In God we trust, all others bring data," which pretty much sums up why we're here today. Because the stories about the impact that we are having on the lives of young people are very, very compelling, but they are insufficient. We in school-based healthcare need to count and be counted on in ways that validate our existence, that express our value, and that demonstrate our ability not just to deliver a standard of care, but to exceed that standard. I also wanted to draw from a more contemporary source, and this is from Don Berwick, who was a former CMS administrator and executive director of the Institute for Healthcare Improvement, from which we draw much of our quality improvement model, who says that real improvement comes from changing systems, not changing within systems. And goes on to say that mere effort can achieve improvement, but such improvement is not fundamental. It does not represent a new level of capability. And this underscores that we're not just striving for better performance by a clinician in a school-based health center. We want that, yes, but we are also seeking improvements in a system, the set of activities with a common aim, and in this case, the larger healthcare system that is aiming to deliver higher quality care with better outcomes at a sustainable cost, sometimes known as the triple aim. And we keep that triple aim as our North Star for the work that we're trying to do here, which is also why we've established a multi-level team concept to this generation of quality improvement. Our sights are set at systemic change at the site, sponsor, and payer levels. And we're also called upon to broaden our lens beyond traditional clinical measures of health. Recognizing the powerful effects of social, environmental, ecological, and economical determinants on health, we must seize opportunities to shape and re-engineer where possible those structural determinants in favor of good health outcomes. It will be a meaningful learning experience, I promise you, and we hope you will join us. We have 3 objectives for our session with you today. We hope that by the end of the webinar, you will have an increased understanding of the coin, that you would be able to identify 3 benefits at least for why you and your state partners would want to participate in this effort. And we hope that you'll be better prepared to submit an application to participate in the coin. And my colleagues Haley and Paula will get into much greater detail about the background for that and the components of the application. The NQI is, at the end of the day, a partnership. A partnership that includes the federal government. And I'm pleased to introduce our project officer from the Maternal and Child Health Bureau, Ite Ibe, who is with us today. We cannot do this work without the support of the Maternal and Child Health Bureau, a 2 decades old supporter of the Alliance and of school-based healthcare. This work is made possible because of their financial support, but also their intellectual contributions that they're making to this work, and also helping us align our work with other federal partners like the Departments of Education and Medicaid and SAMHSA. So we're very grateful to MCHB and to ITE for their leadership in this area. It's also a partnership with the Alliance, the national voice for school-based healthcare. And on the screen, you'll see a number of partners or staffers who are involved in this work. I've mentioned Paula and Haley and Tiara, who are on the screen there, but we're also joined by other staff people to help round out the monumental tasks of pulling off this work. And importantly, we have a partner in the National Center for School Mental Health. I mentioned at the start of this effort that the School Health Services National Quality Initiative is really divided into 2 model parts: school-based health centers and comprehensive school mental health systems. The Alliance is taking the lead on the school-based healthcare coin, and the National Center for School Mental Health is taking the lead on the comprehensive school mental health systems part of the coin. And here on the screen are the center staff who are our partners in this work. And we're pleased to have Shawn Ornstein with us today, who will at the end of the call share a little bit with you about the center's work around comprehensive school mental health systems, quality improvement efforts. To broaden the lens just a bit, and before we get into the nitty-gritty details about the coin itself, the larger objectives of the NQI are to improve the quality of care and use of best business practices that promote sustainability among at least half of school-based health centers and comprehensive school mental health systems. Yes, that is an audacious and ambitious goal. And we are set up for success because of our support from the Maternal and Child Health Bureau and because of leaders like yourself who are ready to engage in this work. The second objective is to actually increase the number and the utilization of school-based health centers and comprehensive school mental health systems by 15%. We believe that by simply engaging in the process of a national quality improvement initiative, we are likely to engage other thought partners and funders, Medicaid particularly, state Title V agencies, who will take interest in this work and begin to seek out new ways to expand the footprint of school-based health centers and comprehensive school mental health services. And lastly, we want to increase the structural components, the policies and funding and programs that promote quality sustainability and that will help us grow this model so that more children and adolescents have access to it. So with that as the backdrop for our time together today, I'm going to turn the mic over to Haley Love, who is going to share a little bit about what this makes possible for you and your state partners in your communities. Haley?
Thank you so much, John, and thanks to everyone for joining us today. We're so happy to see so many participants on this webinar. So I'm going to talk a little bit about what this makes possible for the school-based healthcare field, and I want to share some reflections on where we've come from, how far we've come, and where we're going with this initiative. So we believe that if school-based health centers can align their priorities and voluntarily collect data in a standardized way, we'll be able to describe the quality of care being delivered in SBHCs at the national level, which is paramount to the sustainability of SBHCs. As the healthcare landscape becomes increasingly competitive and based on value rather than volume, we need to be able to demonstrate the care being delivered in our school-based health centers. We believe that by reporting standardized data to the Alliance, SBHCs will be able to compare themselves at local, state, and national levels and compare themselves to other healthcare settings. They'll be able to assess their strengths and areas for improvement. And by investing time in assessing our data and identifying ways to improve practices, the quality of care that children receive will improve. Like John said, this initiative is ambitious. We want to see 100% of school-based health centers voluntarily adopt and report performance measures. So what performance measures, you might ask? Some of you are likely very familiar with the performance measures for school-based health centers, and many of you on the call may have even participated in the selection of that set of measures. But for those of you who may be newer to this initiative, I want to share a little background and context of how we came to have consensus on a set of performance measures for school-based health centers. As you can see on the screen, we started with a long list of potential measures. We invited nearly 100 school-based health center stakeholders to participate in the process of selecting performance measures for school-based health centers. Historically, some states across the country had performance measures and required their SBHCs to report data as a requirement of funding. But what we learned as we got into this work was that the measures varied state to state, both in their thematic areas and in their actual definitions. So what we asked these stakeholders to do was to participate in this process that asked them to tell us what they thought were the most important, sensitive, feasible, and usable measures for school-based health centers, measures that could help us tell the story of the care that we are providing to youth and our value add to the healthcare system. After 6 months and 3 rounds of scoring, we landed on 5 core performance measures for school-based health centers. They include the percentage of SBHC clients who receive the following preventive services: an annual well child visit, an annual risk assessment, BMI screening with nutrition and physical activity counseling, depression screening with appropriate follow-up, and chlamydia screening. We're thrilled with this set of measures and see them as a fantastic starting point for the school-based healthcare field. They align with existing national child quality health measurement initiatives like the Medicaid and CHIP core set and the UDS measures, allowing school-based health centers not only to compare themselves to one another, but to other healthcare settings. The group that we worked with to select these measures forced us to think more about not only what is the value of school-based health center to a healthcare system, but what's the value of a school-based health center to an education system, its value within its community, its value and its influence potentially on other systems like the juvenile justice system. And they asked us to, they with us came up with two what we call test measures for school-based health centers. These measures include seat time saved, which refers to the number of hours saved by having a school-based health center in a school, preventing a student from having to go to another healthcare setting, likely missing a full day of school. Really being able to demonstrate the value of an SBHC to our education partners. Our second test measure was the development of a client experience of care survey. This survey helps us describe and collect data from the perspective of SBHC users on why they use the school-based health center, what aspects of the health center make them feel comfortable and safe and supported as they access care in that setting. As we launch into this next generation of this work, we'll also be looking to add a test measure around assessing and addressing the social determinants of health in SBHC clients. So once we had our set of measures, we started by inviting SBHC providers, administrators, state level representatives, and others to participate in a collaborative improvement and innovation network. So we're now going back to the fall of 2015 when we launched our first cohort of COINs. So for those of you who may be less familiar with this terminology, Collaborative Improvement and Innovation Network, or COIN, a COIN is a professional learning community that brings together multidisciplinary teams working toward a specific goal. For this COIN, we'll be working towards the adoption, reporting, and improvement of the standardized performance measures for SBHCs. We'll be shaping state policies that support SBHCs, and through this whole process, elevating the visibility of SBHCs. Through in-person and virtual meetings, participants in this COIN will access a national network of peers working to achieve similar goals, receive expert technical assistance and coaching, share best practices and lessons learned, and track their progress towards similar benchmarks. So we learned a tremendous amount during the implementation of our first cohort of COINs from 2015 till 2018. Highly motivated groups in Connecticut, North Carolina, Colorado, and Seattle came together. Participants included providers, their medical sponsoring organizations, along with leaders from their state departments of health and state advocacy organizations. They formed teams committed to improving the quality of care delivered in their SBHC programs. And something really fantastic happened. By bringing them together and having an opportunity where they could share some of their successes and their challenges with a community of peers, they started to see changes in their healthcare settings. They started to form more huddles in the morning to talk about the clients they would be seeing that day. They started standardizing tools that they were using to assess risk or assess depression in their clients. They were sharing these strategies and lessons across their peers and helping one another sort through some of these challenges that so many are experiencing as it relates to the reporting of standardized performance measures. They shared challenges around adapting their electronic health records. And ultimately, through this process of meeting together virtually every month, a tremendous amount of change occurred. A lot of the lessons learned from our first cohort of COIN participants are collected together in what we call our Clinical Performance Measures QI Toolkit. This is what we think of as a living document in which the work of this new cohort of COIN participants will contribute to. If you go to our website and access this resource, you can see all of the frequently asked questions, promising strategies, and challenges that were addressed related to each of the 5 measures. With everything that we learned from our cohorts of COINs, we've been working towards nationwide adoption and scale up through annual reporting. Many of you on the call have participated in this. Starting in the 2016-17 school year, we invited all school-based health centers across the country to participate in reporting the 5 standardized performance measures. We had 547 school-based health centers report data on one or more of the performance measures. This is just over 20% of the school-based healthcare field. And while we have a long way to go to get to 100%, we were thrilled to see this level of participation. And given the success of our first year, we've made reporting to the Alliance an annual effort, because with repeated reporting comes opportunity and awareness for improvement. We recently completed data collection and reporting for the 2017-18 school year, and then 100 more school-based health centers reported data on one or more of the performance measures. So now we're looking for our next generation of COIN participants. And we're hoping that many of you on the call will be among this next generation of pioneers who will help continue to drive this initiative forward, who will work together and continue to develop and improve practices in your health centers that can be shared and disseminated nationally with school-based health centers driving the highest quality of care in school-based health centers. For those of you who may be more visual learners, this graphic, which I've just pulled up on the screen, depicts the structure of the initiative and how it's operating. For those of you who may be overwhelmed by too many moving circles and arrows, you might look away. But this slide basically, starting at the top, shows, as John was describing, that this initiative is a partnership of the School-Based Health Alliance and the National Center for School Mental Health. We're working with the Center for Health and Healthcare in Schools and a fantastic group of project advisors and faculty who are helping shape the strategic direction of this initiative. They are participating in the development of the COIN measures, supports, and resources. As you look down to the middle of the slide, you can see that the School-Based Health Alliance is leading 3 cohorts of COINs, and the National Center for School Mental Health is also leading 3 cohorts of COINs. We are looking for participants in cohort 1, which will happen during the 2019-2020 school year. We'll also be leading cohorts of COINs in alignment with the 2021 school-based school year and the 2021-2022 school year. So there may be an opportunity, if you don't participate in the first cohort, to participate in one of the COINs that will be leading in alignment with the following 2 school years. So what you can see here is that we're leading COINs, and you see at the intersection of the COINs something called a state community of practice. When John was describing the objectives of the National Quality Initiative, some of them are focused at the local level, at the SBHC provider and administrator level, but some of them are also focused on a higher level of thinking about systems and how do we really reshape the system in order to have the highest quality of care delivered. So what we'll be doing together is bringing together leaders at the state level for a community of practice to discuss some of those policy issues that may be influencing care delivered in school-based health centers. And with all of the work that we do collaboratively, we'll be seeking to disseminate all of it so that it can be used widely by school-based health centers and comprehensive school mental health systems. So I think what is most valuable is to hear what it's like from somebody who participated in the coin, what it was like from them. We're really lucky to have two individuals joining us on the call today, Jessie White and Anna Goddard from Connecticut. They were participants in the first cohort of our coin from 2015 to 2018 and leaders in the work. Jessie worked at the Connecticut School-Based Health Alliance, so she was working at the state affiliate level with that perspective. And Anna Goddard is a provider who has worked in school-based health centers and can share that perspective from the more local perspective. So Anna and Jessie, thank you for joining us today. And we'd like to ask you to sort of share some of your reflections about participation in the coin around two questions. What did participation in the NQI coin make possible for SBHCs in your state and community? And what elements of the coin were most valuable to you in advancing quality improvement in Connecticut's school-based health centers? So I'm going to turn it over to you guys now to share some of your reflections.
Well, thank you, Haley. This is Jessie White, and I very much appreciate the opportunity to share our involvement in the beginning of the NQI coin and what participation made possible and what we experienced and what we learned. So I think for a little context, our State Association of School-Based Health Centers applied for the first coin, but we had already garnered the participation of 5 different sponsoring organizations that sponsored school-based health centers. And we were careful in that selection that they were sponsored by different types of organizations. So we had some sites that were sponsored by nonprofit organizations, some by boards of education, some by federally qualified health centers, because we believed that they would be all approaching it from slightly different systems with different resources, but all of them were willing to be early adopters and really tread into something that was brand new, but that we all hoped and had a common goal that we could improve performance in the school-based health centers and we could demonstrate it. So that was really important. So for us in Connecticut, from that statewide perspective, the coin did many things, and one of which was to really strengthen our partnership with our Department of Public Health, because they are the primary funder for most of the school-based health centers in Connecticut. We wanted them involved because they already were contracted with all of these various centers. They did request data every year from the centers, and we thought it would be very important for that Department of Public Health to go on this journey with us, so that we could all experience it together with a goal of all of the school-based health centers in Connecticut being able to report on these measures. And I'm very happy to say that at the end of the first year participation, the state program office actually adopted the 5 measures as a requirement for all of the school-based health centers in Connecticut that they fund, and they continue to require that. So we felt that that was really a tremendous victory at the end of participation in the first year. And Anna, do you want to talk about what it was like on the local level?
Sure. Thanks, Jessie. And again, thank you for having me today to share our experience. We were one of the early adopters under Jessie, participating in the Connecticut coin. And I think overall what participation did for us is it really set us ahead of other agencies and other of the different systems that Jessie mentioned, to be able to implement these measures and report them to the state, because once the state adapted these quality standard reporting measures, we were already doing them and doing them in a way that worked for our company and for our agency and for our sites. So participating in the coin definitely put us ahead of any sort of competition, but also showed that we are also experts in the field of school-based health. We were also able to make all of our data comparable to other sites across, not only across school-based health centers in the state, but our data was now comparable to other healthcare agencies in primary care and hospital systems, so we can all talk about the same thing and show that we can match those clinical standards in the field. And I think one of the things, one of the take-home messages I would take or would like to share with everyone on participation for the coin is that we're stronger in numbers. And so the more states and champions all the way down to the community level that participate in data sharing and being able to speak the same language with one another, it shows that the work of school-based health centers are sustainable across the nation. And we need to have that mindset as being stronger as a group.
Thank you, Anna. That's great. So what, in looking at the second question, I think I'll combine a bit both some of the lessons that we learned and some of the successes which address the issue of what was most valuable to us in advancing quality improvement. So one of the things that we did was bring together on the state level all of these 5 teams throughout the course of the year. We brought them together several times in person. Connecticut's a small state, so we're able to do that. But we also felt that it was incredibly important for all of these teams to be able to sit in a room with each other and share their challenges, share what they were learning. We talked a lot about tools and electronic health records, and it was a tremendously valuable lesson in bringing people together face to face. I think that probably that is the one element that all of the school-based health centers that participated would say, among other things, was incredibly valuable. So for instance, people learned that for those who shared the same electronic health record, they would say, well, I don't have a discrete field to be able to enter data about the results of a risk assessment. And one of the other sites would say, well, did you know that there's this field in that electronic health record, and you can enter the data there? And it would be one of those aha moments. Oh, I didn't realize that. Or it was in some cases, the field was there, but it hadn't been activated by the IT department. Which leads me to, I think, the second very important part that we learned universally was that it's very important for someone in your IT staff or your business intelligence or data analysis staff, if you have that, to be involved from the start. We learned that IT staff and clinical staff speak different languages, and that they were able to help people if they understood what it was people were trying to accomplish. So I don't think I can underscore enough how important it is to get them on board right away. We also found it was really important to have an internal champion. That might be the school-based health center director, or it might be someone else who really could champion that relationship between the school-based staff and the larger organization. And we also felt that really on-site support at the school-based health center level was very important to give steady encouragement to keep the team moving forward. And so that people would think big, but act small as they were moving along and building on their successes. And another factor that we found very important was individual coaching. And so I'll just say that we learned from the first year of the coin that we wanted to take it even a step further. And our association applied for private foundation funding. We were able to get to hire coaches that actually worked with the 5 teams on a very individual level. That was incredibly valuable. And I know not everyone is able to do that, but any kind of individual coaching that can be obtained is really very, very helpful, because every team and their circumstances and the school-based health center program and staff are a little bit different. At the end, we brought all the teams together to share their process and their successes. They actually created storyboards, which they displayed at our annual state conference. And it was really a way for them to be able to share with others what they had learned. I would say finally, from my perspective, every team at the end stated that although it was difficult and it was challenging at times, they all felt that they changed how they practiced as a result of being in the coin, and they changed in a very positive way. And every team was glad that they participated in the project. And many of them said that it really helped them enjoy their interaction with the students with much more depth as a result of this work. So I think that that's a tremendous accomplishment, and some participated in our statewide initiative for more than 1 year. So we were really excited. Nobody dropped out, and some people actually opted to be in for 2 years. Anna?
Yeah, that was great, Jessie. I have to agree with Jessie wholeheartedly on everything she said, and just emphasize a couple of her points. By far, the most important element that was the most valuable was that learning collaborative and sharing different ways of doing something with other colleagues and other school-based health centers across the state of Connecticut, but also across the US with the other 5 states that participated in. We also were able to collaborate with the Alliance on data extraction and ways to collect the data and billing and coding and examples. And we were able to go back and forth with one another on, this is the way we're doing this, and will this work for you? And, we found this, specific code didn't work in this scenario. Oh, well, you're a nonprofit, use these instead. And it was so invaluable. And we did improve all of the way we were already, when we looked at the 5 measures, we were like, we're already doing these. But we were able to improve on how we were performing those measures at our sites. And then, like Jessie was saying, we continued to participate voluntarily a few years after, and we kept polishing our performance measures to such a degree that we started getting statewide and then national recognition for some of the work we were doing at our sites. And that all came from us learning and sharing with one another through this coin. That being said, one of the necessary elements that I think everybody can agree with is we really needed a champion for the QI and for the coin at our site, and someone who understood the work of school-based and the measures and can operationalize them. But then a connection with your IT or your information technology staff, because a lot of times what we all found across all of our sites, regardless of the system that you're performing the care in, is that there's a truth in data reporting. You think you are doing something at the client level, but you have to be able to extract it to report it. And so really speaking with your IT staff and them helping you on where everything is entered in a structured data format in the EHR, so that you can pull out everything that you're doing and ultimately report to all your stakeholders on what you're conducting at your sites. Paula?
Before we move to Paula, I just want to say thank you to Jessie and Anna. Thank you so much for sharing those perspectives. They were so rich. And now we're going to transition to Paula Fields, who's going to talk about the specifics of participating in the coin.
Thank you, Haley, and thank you very much, Jessie and Anna. It's always the best to hear from those in the field that is doing the work, and it is very meaningful. So I am Paula Fields. I am the Assistant Director of Programs at the Alliance, but my key role in this work is leading the COIN work, which, as you heard earlier, is a collaborative improvement and an innovation network, and I work as the improvement advisor. With that, we want to talk to you a little bit about what the School-Based Health Center COIN looks like. So the School-Based Health Center COIN will include up to 5 state teams of school health providers, administrators, and state representatives who are committed to engaging in 1 school year of structured quality improvement work. The applicant will identify a state-level COIN champion You heard from Jessie, who was the Connecticut champion, and the importance of that champion. The champion may be a representative from the State Department of Health or Education, from the State School-Based Healthcare Membership Association, sometimes we refer to them internally as the affiliates, or other state-level entities. The NQI Coin Champion will serve as the team lead and should have experience in providing technical assistance to school-based health centers. And a practice pearl here, this is the first question in the grant application. So a champion, someone who can serve as the lead for this work in your state. The successful applicants will also form a COIN team that is comprised of at least 5 school-based health centers and their sponsoring or administrative organization, such as hospitals, local health departments, federally qualified health centers, school districts are some examples. The local team is the third question on the application. Representatives on the COIN team should include administrative and clinical leaders as well as IT support. And Anna and Jessie both very much shared why that IT support is so important, and that's one of the lessons learned from the previous group that we worked with. The school-based health care provider, sponsor, or administrative organizations may be drawn from one metropolitan area or from geographically diverse parts of the state. With that, your state level team, which is the second question in the application, should include representatives, and actually must include representatives from your state government agencies with authority over Title V, maternal and child health, and your healthcare policy and finance, particularly that is often Medicaid. Although Title V and Medicaid are required stakeholders, a formal commitment from these partners is not required by the application deadline. For the teams without relationships with your state Medicaid and Title V at the start of the COIN, one of the goals will be to build and strengthen these relationships. But in between now and the start of the COIN, contact us, and the Alliance will assist in identifying contacts at your state Medicaid or Title V offices. Other state-level stakeholders may include, but are not limited to, the School-Based Healthcare Membership Association, the Primary Care Association, Medicaid Managed Care Organizations, Department of Education, and the list can go on. The last section of the application has 3 essay questions. There is no right or wrong. We are looking for your thoughts and ideas to produce the highest potential outcomes. Next, we would like to talk to you a little bit about what criteria should be present whenever you're looking at your application. So for school-based health centers, we have found that in order for school-based health centers to be positioned for optimal success, they must utilize an electronic health record with the ability and availability of IT staff to capture, extract, and manipulate the school-based health center core clinical performance measures. And a very important part of that is the coding piece. A minimum of 20 hours per week is necessary to ensure the time available to focus on the National School-Based Health Center quality measures and to work towards the development of quality improvement activities, including the PDSA cycles or Plan, Do, Study, Act, and be sure, of course, to have the permission and commitment of your sponsoring agency. Representatives on the COIN team should include administrative, clinical leaders, and IT support. Again, we heard earlier from those and that have actually worked in the field, being Anna and Jessie, of how important this is. So let's talk a little bit about what the timeline looks like, the benefits to participation, and expectations. So if you look, we're here at the webinar today on April the 9th. Your applications are due by May the 31st, and we expect to let states know mid-June of those that are selected. On August the 22nd, we will have a welcome orientation and webinar. Some of the benefits to participation include a two-day in-person kickoff meeting in DC with funding to support travel and accommodation for 2 of your team members. So 2 people per state will bring to DC. And then we will have a one-day in-person learning session in your state. So a kickoff where we can pull the people together across your state that are working towards the common goals. In addition, some of the benefits include 3 virtual learning session opportunities, monthly consultation calls. You will have the peer-to-peer collaboration platform with access to the national network of peers and state leaders who will share lessons learned, address challenges, and identify new strategies to school health services quality and sustainability. You will have expert and peer support on quality improvement efforts. You will have a lot of ongoing professional development, training, coaching, and technical assistance provided at no cost from national experts and peers. You will have access and support for an online data collection and reporting portal, and it will be available for your use up to 12 months after the COIN is complete. And you will also have access to an extensive array of quality improvement materials for the COIN. With that, I want to show you a little bit about how to apply. So to apply, you visit the Alliance's website. You can Google the School-Based Health Alliance if needed, but the actual website is on the page before you, and Tiara is going to post that in the chat box so that you'll have that easily accessible. When you go to the link, you'll notice that there are 2 tracks and 2 delivery systems. You click on the School-Based Health Center track, RFA, and application. Complete the 2-page application, which we talked about the questions in that, and return the application by May the 31st. If you do Google our website and you go to the main landing page, just scroll down towards the bottom and you'll see recent posts where a call for applications now open is. Before we go to questions, we want to ask our partners at the National Center for School Mental Health to share about their school mental health COIN. And with that, Shawn is with us from the National Center for School Mental Health.
Thank you, Paula, and good afternoon, everyone. My name is Shawn Ornstein, and I work on the National Quality Initiative with the National Center for School Mental Health. And I can say on behalf of our whole team that we're very excited to continue collaborating with the Alliance on this important effort and for the next COIN cohort. So as has been mentioned, our track focuses on comprehensive school mental health systems, and broadly these systems provide a full array of supports and services that promote school climate, social emotional learning, and mental health and well-being, all while reducing the prevalence and severity of mental illness. They're built on a strong foundation of district and school professionals, and importantly, the work is done in partnership with students, families, and community health and mental health partners. We wanted to invite those who think that they might be interested in learning more about comprehensive school mental health systems and our COIN track to take a look on our page and application, which is linked on this slide. And just a quick note that if you focus on school-based health centers for this COIN cohort, we would welcome you to apply to our comprehensive school mental health system track for the next cohort. So tomorrow we'll be hosting a webinar similar to this one at 2 to 3 p.m. Eastern Time. And that information is on our application. And with that, I'll turn it back to the Alliance. Thank you.
Thank you, Shawn. Okay, let's move to questions. Tiara?
Yes, hi, thank you everyone. We do see a few questions regarding, is this being recorded? Where can this be available? This is being recorded. The recording and the slides will be available on the Alliance website in 1 to 2 business days. We will send an email to all of our registrants for the link to where you can actually find the location for the recording and additional information. We do have a few questions that are coming in, and I actually want to go back to Anna and Jessie. We had a question that was for the both of you. When hiring a QI consultant in the individual site level, what was provided or offered to the clinicians, school staff, or others as far as coaching?
I can start with that, and then Anna could add on.
Yeah, go ahead.
So what we did in Connecticut was we actually the coaches that excuse me that we hired. They were consultants and specialized in QI, and they worked with all 5 of the teams in Connecticut that were participating. So they offered actually in-person meetings. They also did webinars, and they had monthly individual phone calls with each team, which really helped the team track their progress. The team had self-identified individual goals, and the coaching was really to help them identify any barriers that were happening, either IT or in their organization or in their process, and with good solid suggestions on how to be able to overcome those barriers. And that coaching was offered to the on-site school-based health center teams. So it would be the clinicians as well as in most cases, the individual that was the administrator for the school-based health center program, the director. School staff generally, in our case, in Connecticut, were not a part of that team. So it was mostly the on-site school-based health center staff.
So we were a part of that as well. And that was incredibly helpful at the individual level basis. And additionally, in participating in the Coin with the Alliance, they actually do collaborative learning sessions to launch or to start the beginning of the Coin. And that's where they go over key concepts of QI, different methodology of QI. The Plan, Do, Study, Act is what is most commonly utilized, and they walk you through what that looks like and how to upload them monthly in a database, and then how to just conduct the QI overall without burdening your staff. I think a lot of people struggle with, well, this is what we set up to do, and we've already always done it this way, and they keep doing something. But what's very beautiful with QI is that if something's not working, you stop doing it and do it a different way. And so they'll help lead you through that. And you'll also have a lot of other participants that might be able to give you the direction on what might work for your site versus what didn't work in another site. Was that helpful?
Yes, thank you so much. So now we have a question that's opened up, I guess, for Paula and Haley. How can someone find out about my state applying to inquire if their SBHC can participate possibly under their state?
I can start. That's a great question. And we encourage you to reach out to us directly, and we can connect you with the individuals in your state who would likely be the individuals at the state level leading the initiative. At this stage, we don't have a sense of which states are planning to apply, but we have a few states that we're aware of. But just reach out to us. We can put Paula's email address into the chat box so that you can reach out to her directly, and we'll connect you with the appropriate people in your state.
Perfect, thank you. One of the requirements for participation is that the champion needs to have experience providing technical assistance to SBHCs. As an emerging affiliate with a very new organization, does that mean they are ineligible?
Paula Fields, and I'll take that. And no, it doesn't mean you're ineligible. We have technical assistance and training available that we will provide to our state level representatives as well as within the state. And we'll go over the model for improvement called the Institute for Healthcare Improvement Breakthrough Series. And we also will have monthly calls to help with that. So we will be building a skill as we go through this, with the intent at the end that you'll have a skill for your state to move forward as you want to. And as we've talked about, we've been working with several states, and Haley had talked earlier with some of the ones in North Carolina, Connecticut, Washington. So we're excited to work with a new group of states as well.
Perfect. Do you have any recommendations for identifying the local teams?
So local teams that are looking to apply?
It may be individual school-based health centers who may be interested. We recommend sending out the call for participation, the request for applications to all school-based health centers in your state, to ask them if any of them may be interested in participating in an initiative like this one. That way you can identify the programs who may be motivated to join this type of initiative.
And if you don't have that list ready at hand, we might be able to help you identify those sites as well. And again, that would be a request that you could direct to Paula, and we could coordinate that from here.
Absolutely.
That's John, by the way.
So what if someone's already participated in the past? Can they participate again?
Yes, teams in any state or territory can apply. There was a question previously, or that someone may have interpreted the focus on Connecticut being that only Connecticut has participated in the past. We've had 4 states participate during our coins led from 2015 to 18. They were in North Carolina, Seattle, Connecticut, and Colorado. And those teams from those states are eligible to apply. If you've participated in the past and you're interested in applying again, we encourage you to identify new school-based health centers to apply. But SBHCs in any state or territory are eligible to apply to participate in the coin, and we will be selecting 5 states to participate in the first cohort, 5 states to participate in the second cohort, and 5 states to participate in the third cohort. So 15 states will hopefully participate in coins over the next 3 school years.
Okay, maybe if you can clarify too, who can apply? And can you provide examples of members of the team?
Paula, you want to take that one?
Sure. So who can apply? And to answer that question, we recommend, just a minute, let me get the wording exactly, that a state application come in with your state champion, and the state champion would include the representatives that we recommended having in place around 5 school-based health center teams. And the application is very simple as far as you identify the state champion, then you list your 5 school-based health centers minimum per state. And then hopefully Medicaid and Title V will be on board too. But that is one way. There's multiple ways that it may come in, but you need to have your team together in order to do the application.
We see leadership coming from many different pathways and sectors. It could be a Department of Education that's running their school-based health center initiative, and the Department of Education would like to be the lead champion. It could be a public health agency at the state level that's running a program office for school-based health centers. It could be one of our state school-based healthcare advocacy and membership associations as the lead champion. So we're not thinking of one particular person or entity, but imagining a host of possibilities there. But they are responsible for the big, sort of keeping an eye on the big picture of coordination and a focus around some of the state policy level engagement. This isn't just about site level change. This is about systems level change and connecting this to the larger systems level quality improvement efforts going on in your state. So the champion really should be in a position to be able to corral all the key players that can make that work.
Yeah, and it will look different from state to state depending on where that skill set and that person is.
Great, and we'll definitely try to take a couple more questions. We don't want to definitely hold you all too long. And those that we aren't able to get to, we'll make sure that we contact you directly in response to your question. So another one we have is, should we share this information with local SBHC programs or other state agencies involved in SBHC programs?
Absolutely.
Exclamation point.
Exclamation point.
Please, we beg of you.
With local SBHC programs and encourage their participation. I think by doing so, you will identify those who are likely most motivated and enthusiastic about participating in an initiative like this. So spreading the word far and wide will help identify the right participants.
Absolutely. And again, to reiterate, if you're interested and you want to participate, but you're not sure who else to contact in your state, drop us an email and we will help you make those connections where we are able to.
Great. And I'll give this one last question. How long is the coin and how frequent are the gatherings as far as like in person, virtual, and what are the expectations?
Sure. So the coin lasts the school year for the 2019-20 school year. We will start in September, where we have the where we invite the two people from each state to join us for a national leadership launch meeting in DC, and then we'll follow up by completing the site visits, meaning that we will visit your state for a statewide kickoff meeting, and then we will convene monthly virtually from October to June. And these virtual meetings will be structured around providing participant opportunities to share promising practices, troubleshoot challenges, and you'll have access to the support of quality improvement experts around quality improvement methods and improvement coaching, improvement advisor. So the school year is the time.
Perfect. Thank you so much to everyone. We have launched our evaluation poll questions. We will appreciate if you can take time just to answer these questions before you log off. And to our presenters, is there anything last minute, moments, comments that you would like to add to our presentation today?
No, we just thank you all for your time and your curiosity. We hope that we have motivated and inspired you to think fresh about this work. And to seek us out if you have more questions. Again, we are here and want to help you be successful in this application effort. So we hope to hear from all of you. Thank you very much.
Thank you, everyone. Have a wonderful day.
Thank you.